If you have groin pain, especially at the junction between your thigh and pelvis, I suggest you stay until the end of the video because I'm going to show you 6 ways to significantly relieve the pain. They're so impressive that you'll think they're magic, and you won't need anything special to do them. A place to lie down, which could be your bed, a sheet of paper, and a chair for some exercises will do standing up. Let's start with the first one. We lie on our backs until our head and torso are resting on the bed, the floor, the mat, whatever it may be. It's an extremely simple exercise. Pay close attention. We're going to bend our legs and try to open up the front angle of the hip. I'm always going to do the example with my left leg, so if you have issues with your right leg, just switch sides. The main point of this exercise is to position the leg that we're not going to work on, in this case the right one, very bent. As you can see, my heel is very, very close to my butt. Let me show you up close. Here you can see how my heel is very close to my butt. Opposite leg, we're going to place the ankle of my left leg, which will rest at the level of the thigh of the right leg, as if I wanted to cross my legs. And here, the closer this foot is to my hip, the closer that heel is to my body, the more effective the exercise will be. Okay. Heel very close to the glute, and then this heel here, very close to the body. From here, it's extremely simple. All I want is for you to place your hand at the level of your knee and lower it as much as possible. Hold that position. 1, 2, 3, 4, 5, 6, 7, 8, 14. 9 and 10, and relax. As you do it, I'm sure you'll start to notice a feeling of openness here. At the level of your hips, you can't reach. This happens with a lot of people who have short arms or don't have enough flexibility. You can grab a book, you can grab a cushion, place it at the level of your knee and push it. This increases our range of motion and makes the exercise more effective while keeping 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and we relax. Very good. Feeling of stretching, opening at the hip level, especially in the front. Let's go again. You can use a book, a cushion, whatever you want, something bulky so you can lean on it and push. We push hard. 2, 3, 4, 5, 6, 7, 8, 9 and 10, and I relax. If you don't notice anything, it's probably because you're not setting the parameters correctly. Remember that your right heel has to be very close to the opposite buttock, and your left heel has to be very close to the right side of your torso. You can readjust everything a little more once you've done several repetitions to increase the intensity. I grab my book, cushion or whatever, rest it on my knee, and lower myself as much as I can. Nice. 2, 3, 4, 5, 6, 7, 8, 9 and 10. Last rep. I'll use the other hand so you can see clearly. From that camera, I push down and try to open it with my other hand, but it doesn't work. I can't reach that far. 2, 3, 4, 5, 6, 7, 8, 9 and 10. Relax. We've done 5 out of 10. You can do a little more if you want, but to keep it from getting too long, let's move on to the second exercise. I'm going to keep this pillow very close to me because we're going to need it. Pay close attention. I want you to fold it a couple of times and place it under the buttock on the side where you have pain. In this example, we're doing the left side, so I'll leave it right there underneath. The goal is, as you can see here, that there's a certain elevation between the mat and the wall that allows us to open up that hip even more. Pay attention. We'll stretch the right leg, but don't move it along the floor. The right buttock may or may not touch the floor depending on how high the cushion we just placed is. And next, I'm going to place my foot, as you can see there, on my right knee. Okay, not on the inside, but on my right knee. I'll say it again, but from here, on the knee, not on the inside. What it's going to do is act as a lever arm, and then what I'm looking for is to let my leg drop little by little, very gently, very calmly. Use this hand to help yourself and avoid injury until you feel some tightness. It's intense here, I'm warning you, and the higher you place that cushion, the harder the exercise will be. We hold the position for a few seconds, up to 10, 1, 2, 3, 4, 5, 6, 7, 8. 9 and 10, and then we bring that leg back to vertical. Be careful, because it's intense, especially for those of you who have some lower back pain. If it's too intense, we can take that cushion, unfold it, and support ourselves again. You need to try, otherwise you won't know your level. For me, this one feels a bit uncomfortable. I place my foot here again, on top of the opposite knee, and let my leg drop down again. It's more pleasant, less tense, less intense too, and I let it drop until I feel some tightness. The trick is the foot position. It's just like before. Did I mention that the distance from the heel of the body affects the exercise's difficulty? This is similar. Placing my heel far from my body lowers the intensity, while placing it close increases it. Here, you have to measure it yourself, okay? Foot above the knee is more intense. Be careful, let's not force the foot too much over the knee or below the knee. It's a simpler exercise, so you have to try to find the level of difficulty that suits you best, depending on those two factors. First, the height of the cushion, and second, the placement of the leg. I'm going to place my leg above the knee and hold it there. Very good. 10 seconds. I place my hand on my leg. To make sure that it's always controlled at 23 and I try to relax. 4, 5, 6, 7, 8, 9, 10. I relax and return slowly. I can use my hand to help since coming back and breathing will be difficult for you. We haven't done 2, we'll do 3 over 10 now. Do you feel the intensity? If the first exercise caused discomfort, skip this second, as it's more intense. I leave my foot in the same place and let my knee drop. Down, big stretch 2, 3, 4, 5, 6, 8, 9, 10. I relax and return to the start. Let's do 2 more. Changing the camera so you can see it well. I'm going to bring my heel up a little closer. There. That's more intense. And I let it drop. 3, 4, 5, 6, 7, 8, 9, and 10. What matters isn't touching your knee, but feeling tension in your groin. I come back slowly, I help myself with my hand, I breathe, and let's go with the last one. I let it drop 2, 3, 4, 5, 6, 7, 8, 9, and 10. Very good. I bring my leg back. Impressive. I remove the cushion, place both feet on the floor, and relax a little. The lower back may have suffered a bit during the exercise, but it's not very serious. We do a small rocking movement and now we stand up, because we're going to work on the exercises from a different point of view. To finally finish here again. Lying down, massaging that inner hip muscle with a ball. Let's go for it. A chair, a cushion, and a sheet of paper is all we need to work on these amazing exercises. Pay close attention. We're going to place the chair like this, with the seat facing me, and I'm also going to put this cushion on the floor. I'm going to use the chair for support, and rest my left knee on the cushion. I'll move the chair slightly from the wall so my right leg can go forward. I'm not sure if you can see, but my right leg isn't very bent here. It's more stretched out, with about 60 degrees of flexion. The goal, as always, is to open up that part of the left hip's groin. We'll do it with a PSOA stretch. That's truly impressive. I place the chair closer or farther away, depending on how comfortable I am, and if you have knee pain when you lean on it, use a slightly thicker cushion. I lean on that chair, and what I'm trying to do is bring my pelvis closer to it. Look closely, I'm lowering my pelvis down. The goal is to open the angle between my torso and my leg, open the angle between my torso and my leg. I rest my hands. I slide forward, stay very straight, and begin to feel tightness and some discomfort in the front. Lumbar level is normal. I hold the position. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And I slowly sit upright. Very, very good. Come on, let's do it again. I lean, I bring myself forward. I don't do this, no. Very upright, and the angle between my torso opens up, and my back leg, and I hold. Doesn't it pull here first, in that iliac fossa, and I count to 10, 2, and... He stops stretching. Capilla supplies. 9 and 10. Very good. I return to the starting position, and let's add a bit more difficulty. My hand is placed at the level of the nape of my neck. Pay close attention. Very upright. I try to point my elbow toward the ceiling. I support myself with my hand so I don't fall. And bam! That pelvis goes forward. Very good sensations. Very good tightness at the level of the groin. 3, 4, 5, 6, 7, 8, 9. 9 and 10. Relax. I return to the starting position and rest. This incredible stretch is one of my favorites. We stand up, let's switch. 10, relax, I return and rest. Incredible, one of my favorites. We stand up. 10, relax, I return to the starting position and rest. Incredible. One of my favorite standing stretches, one of my favorites. We put our I go back to the starting position and rest. Incredible stretch, one of my favorites. We put our foot down, let's and rest, incredible stretch. Then I go back, incredible, my favorites. Very straight, I let that stretch go back. Very straight, again I open the angle between my body and that back leg. 2, let's go again. 3, let's go again. 4, let's go again. 5, let's go again. 6, let's go again. 8, again. 9, final rep. Very good. Do you see how I go down? Impressive. And 10. And I come back. 3. It's fine if the tip of the foot moves slightly to the side. I'm back. 4. Shouldn't it be like this? That's forbidden.